Let's discuss restoration of dental situations where there are no teeth. What are your options if there are no teeth? You can either leave it with no teeth, or conventional dentures, or implant supported removable dentures, or prosthesis that don't come in and out. That's called all on 4 or all on 6. So all on 4 or all on 6, which is what we do, doesn't come in and out. And the implant supported removable dentures do come in and out, but they're supported by implants. In my practice, I support them with small diameter implants, also called mini implants. I really like those. The reason I like the mini implants is because with all on 4, these are the pros and cons of both, if you're asking me. We do about 50 implant supported removable dentures for every one all on 4 we do, all on 6. The reason for that is the all on 6 is a more expensive procedure, and X number of implants are going to be lost. Roughly 10% of implants average are lost from a variety of different reasons, even if they're placed well. And so if you lose an implant with an all on 4, especially an all on 4, now all on 6 you've got a little more latitude, but if you lose one of those implants, you may have to replace the prosthesis in that arch. If you lose a small diameter implant, you just take that out, move over, put another implant next to it, make a little hole in the denture, pull a housing, the patient walks out of the office in an hour. The maintenance is not as big a deal. Whereas if you lose an implant with all on 4, all on 3 doesn't work. All on 6, you've got a little more latitude for a lost implant without having to redo the prosthesis of that entire arch. So, and if the denture is made well, the implant supported removable dentures look like veneered teeth. That's what I tell people when we finish one of these restorations. I said, when people ask you, when they say, gosh, your teeth look so gorgeous, what have you done? Say, Dr. Cutbirth veneered my teeth, which is not telling the truth, because the restorations are basically the same restorations we use for veneers. They're not the cheap denture teeth that you often see, those old plastic teeth. I don't do dentures without implants. Now, I certainly think there's a place for dentures without implants. Why don't I do dentures without implants to support them? Number one, I want the patient to like me. And number two, I don't want to see that patient week after week trying to make a denture fit, when if you don't have the right arch form and the right patient that can tolerate a removable denture without implants, you could adjust that denture for the rest of your life and never make it fit. Now, some dentists are probably better at that than I am. I'm not good at adjusting a denture without implants and making it fit, whereas I know when I do an implant-supported removable denture, that patient is going to love me at the end because they're going to look fantastic and they're going to stay in place. I had a Baylor professor that I restored with implant-supported dentures a few years ago, and he'd had a conventional denture, and he retired from teaching because he said he was always feeling the denture move and was afraid. He said they would rise up, and he was afraid he was going to lose the denture in class, so he retired from teaching. So he came to see me, and I fabricated an implant-supported dentures. After he'd had them for a year or two, he was in the office for a routine cleaning, and he said, you know what, Dr. Cutbirth, if I'd seen you first, I'd still be teaching out at Baylor. He said, these are actually hard to get out. And he said, that's a good thing if you've ever had a conventional denture. So I really like implant-supported removable dentures if someone doesn't mind having something that comes in and out of their mouth. Now, how often do you have to clean them? Every day. You've got to let the tissue rest with the dentures out of your mouth at least, ideally, 3 or 4 hours a day, because it's kind of like wearing your shoes. You want to give the tissue time to rest. With all on 4, like I said, we do all on 6. You've got to be able to clean under the prosthesis. So we'll look at cases of these. This woman had been like this for 20 years and met and married a guy in her Sunday school class. And on her honeymoon night, she said, I want Dr. Cutbirth to fix my teeth. And her husband said, go to it. So these are the implants. And these are implant supported removable dentures. Now none of these pictures have been touched up. You can see that looks like, hopefully you'll say, natural teeth. This very nice woman, attractive woman, but just had some hard miles and spent money on kids and things. Life got in the way, and her teeth just got out of hand, and she thought it was just hopeless. She said, I know there's nothing you can do. And I said, we can fix anything with the tools we have at hand today. We can fix any dental situation with a combination of different things. So you can see missing teeth, broken teeth. This is her before and after with implant supported removable dentures. And with implants, you can cut the palate out of the upper denture, which people really like because some people have a gag reflex or the taste buds on the roof of the mouth are affected, and it makes them feel like they can't taste their food as well. So this is a real plus of implant-supported removable dentures. This lady was from a town about 3 or 4 hours from here, had been to a divorce, and just became depressed and quit taking care of herself, and again thought she was hopeless, that there was nothing you could do. I said, don't worry, we can fix anything. Now, there may be a few teeth you can save, but I tell patients it's like a house that's been damaged in a hurricane, and the floors are soaked, the walls are soaked, they've got termites, the roof's blown off. You probably could save the house, but it's more effective and you could achieve a better result if you take 3 bulldozers at the curb and knock it down and start all over again. That's the case with so many of these cases. There may be a few teeth you can save, but it's not worth it. You can get a better result taking them all out. So these are implant supported removable dentures. This nice fella, just life got in the way again, and spent his money on other people, his children and what have you, and before he knew it, he'd lost a bunch of teeth and was just very embarrassed with a smile, didn't want to go out. His mother actually brought him in and said, we're going to fix his teeth. You see, there are some teeth that are savable, but what are you going to do with those teeth? If you tried to save the teeth, you're going to spend a fortune because you'd have to put individual implants in here, and you couldn't achieve the result you could have if you take them out and just start all over with either all on 4 implant supported dentures. So all these cases I'm showing you initially are implant supported removable dentures. People are apprehensive about having their teeth out. I would be too, but it's just life. You've got to come, after people come to grips with the teeth are coming out, then the silver lining is they have such a fabulous result once we fix them. Now he's confident, got married. This woman couldn't go out. She was so embarrassed about her teeth. And again, life got in the way. She's a good woman, just had other things she had to spend her money on, and ended up with a bad dental situation. All these teeth are lost the teeth. Also had to remove the tori. These are the implants on the top and the bottom. These are some of the happiest people in my practice. I tell them we don't have a bad case. And when they go from this to this, you can imagine how fabulous that is for them, and so satisfying for us to know every time we're going to have a fantastic result. We're not going to have anything but a fantastic result. And I'm all for and appreciate dentists that can make dentures without implants. I'm just not that guy. This guy was a contractor, just had a tooth here, a tooth there, big bridge, and these teeth were decayed, missing teeth on the bottom, just been working hard. You can see the decay, just decay everywhere. And it just gotten to the point he felt like he was always having a toothache, something was breaking down. And if somebody has a lot of restorative work, a lot of old crowns that are decayed, you never know what's underneath that crown until you take the crown off. And it just was time, again, to take those 3 bulldozers at the curb and just knock everything down and start all over again. And I'm always flattered when patients have the confidence in my practice to let us do this, because that's a big step to take all your teeth out. I realize that. And the number of implants you place, in a perfect world, I like to place 6 on the top, the maxillary arch, and 4 on the mandibular arch. Sometimes the bone is just not there. to place that many implants. So I've had as few as 2, and that worked well. 6 is usually about the most. But the sinuses affect how many implants you can place. The mental foramen, the inferior alveolar nerve affects how many you can place. And then sometimes, especially in the maxilla, the bone is just soft. It's not strong enough to accept 6 implants. So however many you have, 2, I've had that work well. And that may, in a very few cases, I could only place 2 or 4. Most of the time, though, there's not a problem placing 6. This woman, just a train wreck. See implants. Now, what affects implants? The same thing that affects teeth. If you smoke, there's a high probability you're going to lose your implants, just like you lost your teeth. When people get decay, that's from drinking Cokes and eating candy, and when they lose teeth from decay. When they lose teeth from gum disease, that's usually oftentimes from smoking. So don't smoke, and surely don't smoke after you've had your implants. I make patients promise or sign something saying, I understand if I smoke, I'm going to lose my implants. And I don't place the implants if they've been smoking until they've stopped smoking for 3 to 6 months, just to be sure they can really quit. But if they start again once they get the implants, there's a high probability they're going to lose the implants just like they lost their teeth. This woman was a grandmother. She said, my teeth scare my grandchildren. These are the implants. All these people, all these patients say, the nice thing about them is they're not easy to get out. You can take them out, but they're not easy to take them out. And it's like the Baylor professor told me that had the plain dentures before they had the implants. He said, before I had these implants, I thought about my artificial teeth 24/7. Said I always thought about them. I was always aware of them because I could feel them moving. He said, I never give these a thought. Once I put them in, they are so locked in. I don't ever think about them. I can laugh, talk, sneeze, and never think about them moving or coming out. This gentleman had had these braces on his teeth since he was 12 years old. Now he's 47. And when he came in, he said, I'm here for one reason. He said, I would like to have a date with a woman before I die. I said, okay, let's make that happen. So the teeth were just destroyed from those braces not coming off, being on the teeth, about 30 years. So guess what happened to him 6 months after we finished this case? He got married. So case success. There's his implants. These implants, you've got this implant, and then you've got a housing with a rubber O-ring inside the denture. And so they snap, the denture snaps on the implants like a snap on your shirt, but a lot stronger, like this snap on my shirt right here. It snaps in just like that, but these are about 10 times stronger than a snap on your shirt. So they're very stable. You put the implants normally in the front part of the jaws, because you've got sinuses in the back part of the upper arch, and you've got a big nerve down here called the inferior alveolar nerve in the posterior part of the mandible or the lower jaw. So you don't want to put an implant into that. Sometimes you have enough vertical space to put implants in the posterior part after you've extracted the teeth. If you do, then I place implants back there, and it makes the denture even more stable. But most of the time you don't, and you place the implants in the front part. These are the dentures. And again, we're not using those cheapo plastic teeth. These are teeth similar to teeth that we use for veneers. Nice woman. This lady was a hippie chick from grew up in the 60s, and teeth had just gone away. A lot of this is from smoking. So they have to quit smoking before I'll place implants. They have to quit smoking for 3 to 6 months, and they sign a sheet. I want everybody to know what they're getting into, that if you keep smoking, I say you will lose your implants, just like you lost your teeth. So be an adult. If you're going to do this, I say, unless you're just looking for a place to spend money because you like me so well, don't smoke. Don't smoke. We give patients something that they pick up called Smoke Away. It's pills that in theory cleanse all the nicotine from your body. And you take 2 months of this, and you can get them at different drugstores. You get them online, called Smoke Away. And we've had very high success with people stopping smoking. But the bottom line is, you got to want to stop. You got to want to stop. Okay, so you can see just too much going on to fix. These are the implants. Like I said, with the implants, there's so much stability with the implants. You don't need the suction on the roof of the mouth, so you can cut the palate out, which people really like, because some people, as I said, gag, and you've got taste buds on the roof of your mouth. It makes food taste better. Teeth really, really make people look youthful, in my opinion. So this gentleman only had 6 teeth left, and you can see this one was abscessed, and we're able to save the bottom teeth. We lost this tooth, and so we placed a Maryland bridge down here and restored his bottom teeth, but took the top teeth out. These are the implants. There he is with the upper removable denture, and then we've restored the bottom teeth. This is a Maryland bridge, and then we placed an implant over here, implant here, Maryland bridge right here. Again, lady had kids, spent her money on them. Teeth were just patched and patched and patched, and it's like patching up a house or patching up a car. There comes to a point that you just can't patch it up anymore. And that's what I told her. I said, some teeth could be saved, but they're so patched up, decay underneath the old crowns, that it's just time for the 3 bulldozers at the street to knock the house down and start all over again. So I sedate patients intravenously when I'm doing the big things like taking the teeth out and putting in the implants, so you can make it very comfortable. See, everything was just patch on patch. So these are the implants, before and after. This guy had dentures, but he didn't like the dentures that he had, and they were very unstable. And he had a partial down here, and then just an old denture up here with the old plastic teeth. And you see he had the partial hooked on to these, and it wasn't stable, so he wanted something that was more stable. So here's the implants in the top and the bottom. Nice gentleman from town, about 3 or 4 hours from here, and just life. Teeth that decay under the old crowns. And I see so many of these cases. We do so many implant-supported dentures. And then, like I said, we'll do 50 of those for every one all on 4. But when I'm examining the patient, I'll look at the radiographs after the assistant's taken the radiographs, and I just get this overwhelming feeling this is too much to restore if we try to save the teeth. It's really pretty obvious. Even if there are a few teeth that you could save, I could probably save these teeth with root canals and crowns. And if a person was lighting their cigarettes with $100 bills, money meant nothing. They could spend a fortune on this. You could probably do it, but it just becomes impractical for most people, both from a financial standpoint and from the amount of work you'd have to do if you tried to save the natural dentition. Took the teeth out. See, we didn't have enough bone. We didn't have enough good bone up here for the 6th implant, and I was able to put 5 in on the bottom. Cut the palate out. This lady had an old denture. You can see it had just been rode hard and put up wet. Had lots of wear, and broken it and repaired, and had a partial down here. And so we had terrible bone, though. When the teeth were taken out, all this bone was lost, and that bone was just like mush. So I was only able to put two small diameter implants in the maxilla, and we're able to put 4 down here. See all the bone. When they took the teeth out, they moved the teeth to the side and lost all the facial bone, and there was just not enough bone to place the normal number of implants. Cut the palate out. Even with the 2 implants, this was very stable. This lady's teeth had just gone awry. A lot of decay under old crowns, missing a bunch of teeth. All this decay, missing posterior teeth, and it just becomes such a job to save the natural teeth and restore the spaces that it's just better sometimes to take them all out and start all over. The missing the posterior teeth is the lower arch. Cut the palate out. The other thing is, when you've got all those teeth that are infected and gum disease and decay. There's tons of bacteria that goes with that gets in the bloodstream. It's called bacteremia, and it goes all over your body, and that's not good for the organs. So you don't want all those infected teeth with all the bacteria in your system. This good guy had a rough life, teeth just decayed. Nice fella, but just decay everywhere. Missing teeth. You know, I'm just so happy to be in a business, in a dentistry today, when we can fix anything with the tools we have to work with. Because a lot of these people, this is after we're finished, cut the palate out again, before and after. This guy was in sales and missing back posterior teeth and had decay under all these crowns on his front teeth and back teeth. These had been patched in the back, and it's philosophic for me when we decide to take somebody's teeth out. That's like cutting a tree down that's been in your yard been present for a long, long time. It's not just, oh, real quick, let's take those teeth out. We talk about it for a while, the implications. I want them to know exactly what is going to happen and what they can expect when we're through. And that's the thing I like about implant-supported removable dentures or all on 6 or 4. You know what you're going to get. If you give somebody just plain old dentures without implants to support them, you don't know what you're going to get. And my personal experience, I'm not saying it's this way with all dentists. There are probably some out there that are good at making dentures stay in without implants. I'm just not that person. I know what's going to happen with implant-supported removable or non-removable prosthesis. So he just had decay everywhere and was tired of messing with teeth. So this is after we're finished. So I know we're going to get that result every time. And when we're fabricating these dentures, we're sure to get the vertical dimension correct. That's the difference between the nose and the chin. When the patient closes their teeth together, that's a prescribed measurement. Notice when a patient hums and lightly touches their lips together, and you put tape on the tip of their nose and their chin, say that measurement was 70. The vertical dimension of that patient's occlusion would be 67, 3 millimeters less than when they're humming, because when they're humming, you want the teeth to be apart. That's called freeway space. The vertical dimension of occlusion is when the teeth are together. It's the contracted length of the muscle. So we measure that so their vertical dimension is correct, and they're very comfortable. All right, now this is an all-on-4 case. Like I said, now we do all-on-6. But all-on-4 or all-on-6 don't come in and out. So if somebody wants a prosthesis after their teeth are removed that doesn't come in and out, we've got that with all-on-4 or all-on-6. So this lady had some old bridge work that was decayed. This is a bridge up here, decay underneath them. You can see decay on those teeth, decay here, just decay everywhere. And they had placed these implants, but all this was decayed. There wasn't enough vertical space here back between the implant and the lower jaw for a restoration, even if you'd wanted to place it there, which we didn't because we had so much decay going on everywhere else. It was obvious to me and to her that it was over. You just feel that. So here's the all-on-4, and you put 4 implants in. Like I said, now we put in 6. That's the upper, and this is the lower. And then here's the prosthesis. It's a bar connected together with holes in it, and you screw this bar into those implants. And so this is the all-on-4 or all-on-6. The issue with all-on-4 is if you lose this implant, all-on-3 doesn't work. You're probably going to have to replace the entire arch. Now with all-on-6, you've got a little more latitude. You don't always have to replace the whole thing if you lost an implant. And you don't lose implants that often, but about 10% will be lost, and you always like to think through, what am I going to do if that happens? The way I look at all-on-4 and all-on-6 is if somebody has got the money to spend and the money to maintain it. It's kind of like buying a house. You know, the cost of the house is one thing, but the maintenance is something else, because the patient is the one that had the problem. I didn't have the problem. I can fix it, I think, the best it can be fixed, but there's maintenance with most things in dentistry, the potential for maintenance for most things in dentistry that are restored. If a patient didn't have the funds to replace this, if they lost an implant or two, which I'm hoping doesn't happen, but if it did, you don't want to get into a mess and a bad situation. So all on 4, all on 6 is a little more involved in my opinion, and the maintenance has the potential of being more costly than implant supported removable dentures. So this again is the all on 4, and those are beautiful and work really well. See, so you have to clean underneath them. Sometimes we'll keep this considerably over the gum line, so there's a pretty good space underneath there, so it's easier to clean with a water pick or super floss. You thread underneath there, and it's a floss that's kind of like a yarn, and you've got to clean underneath it. And then normally we unscrew these every year or two and just clean everything real well. So you got to clean underneath here with a water pick or super floss. That's the Dental Minute. These techniques work, and they work every time.
Take your practice to the top tier. Subscribe to dentistrymasterclasses.com for an organized library of all the Dental Minute videos, plus many complete comprehensive cases and many very important articles. New cases are added weekly, only $20 per month. Subscribe now.